This video will provide you with an overview of heart transplantation and help you participate in making an informed choice. Living with heart failure can be a major burden on patients and their families. A heart transplant can be a treatment option for your heart failure, and your healthcare team will assess whether transplant is right for you. What is heart transplantation? Heart transplantation involves major surgery, during which your failing heart is replaced with a healthy human heart. Although transplantation is one of the greatest achievements of modern medicine, it is a treatment and not a cure. Transplantation is entirely dependent on the generosity of donors and their families. Is heart transplantation an option for all patients with heart failure? Transplantation is not an option for everyone. You will undergo extensive investigations, otherwise known as the workup, to answer the following key questions. Is your heart sick enough? Is the rest of you healthy enough to survive surgery and recover? And do you have adequate support to help you cope after surgery? What happens after the workup? After the workup is complete, your team of doctors, nurses, surgeons, and allied health professionals will discuss whether heart transplantation is the best option for you. If a heart transplant is not the right option for you, the reasons will be shared with you. We encourage you to ask questions. Some patients may be eligible for a mechanical heart, while others may be too sick for any surgery. In either case, we will continue to provide support for your medical needs and symptom relief. If transplant is the right option for you, you will be put on a waiting list. Most patients wait at home and are seen regularly in clinic. Very sick patients may have to wait in hospital until a suitable heart becomes available. Time on the waiting list varies from days to months or even years. While patients wait, their condition may change. A few patients will improve, while others will become sicker, resulting in a hold being put on their transplant or removal from the waiting list, and others may die while waiting. It can feel difficult trying to get on with life, and the uncertainty can be stressful. We have resources available to help you cope during this time. A heart can be identified at any time. You must be easily reachable and should always ensure we have the most up-to-date contact information. You need to live within 4 hours travel time from the hospital. What will happen during my transplant surgery? Once a potential organ has been identified, we will contact you and ask you to come to hospital as soon as possible, where you will be admitted to the coronary intensive care unit. Do not have anything to eat or drink. Bring all medications with you. Bring personal items you will require during your hospital stay. Every donor heart will be checked by the surgeon. If the heart is not suitable, surgery will be canceled before it even starts. While this is understandably upsetting, it is sometimes unavoidable. If the surgery is going ahead, the surgery should take 4 to 6 hours to complete. Most patients will have a catheter inserted through a large vein in the neck to measure the pressures inside your heart. You will be under general anesthesia. An incision from the top center of your breastbone down to your stomach area will be made. You will be connected to a heart-lung bypass machine that will keep your body working while the surgeon is performing the transplant. Once the transplanted heart is in place, the bypass machine will be slowly turned down for your new heart to take over. Your chest will be closed and the skin sutured and dressed. Sometimes, if the new heart can't fully support your circulation, you may need to be temporarily supported with a mechanical pump. What will happen after my transplant surgery? After surgery, you will be brought to the cardiovascular intensive care unit. Most patients will be woken from anesthesia within the first 24 hours. When you awake, you will be on a breathing machine until you are strong enough to breathe on your own. See tubes and IV lines that were put in during your operation. These will be removed as you get better. Receive many medications. When you no longer require care in CVICU, you will be taken to the step-down unit, or the general transplant ward, where you will meet the rest of the transplant team. The team will help you get stronger, teach you about your new medications, facilitate your transition out of hospital. We encourage you to become an active partner in your care and to learn about your health. When will I go home? The average stay in hospital after transplant is 2 weeks. However, this is variable. Before you can go home, we will make sure that you and/or your caregiver have learned about your medications, know how to reach us using our Easy Call communication system. What should I think about when living with a transplant? A heart transplant is a major life change, and there are a number of things a transplant patient needs to learn to live with. New medications. You will leave the hospital taking 10 or more different medications. Some of these include immunosuppression or anti-rejection meds. You will be taking these medications for the rest of your life. They protect your new heart from being attacked by your immune system. Please check with us whenever other physicians prescribe a new medication, as some interactions can cause serious harmful effects. Only your transplant team is allowed to make changes to your immunosuppressant medications. Antibiotics and antivirals. After transplant, you may be at risk for various infections, as your immune system is vulnerable. These medications help to prevent some of them. Biopsies. Biopsies are currently the best test to diagnose rejection. Biopsies are scheduled according to protocol. You will be awake for the procedure, and your skin will be frozen with local anesthesia. A small tube is put into a big vein in your neck or groin. Under X-ray guidance, 4 to 6 tiny samples from your heart are obtained and sent to the pathologist. This takes about 15 to 20 minutes to complete, and you are monitored for 30 minutes afterwards. Your first heart biopsy will be performed 7 to 10 days after surgery. Weekly hospital visits for the first month, and very frequently for the first year. Plan for a full day at the hospital, as many of these visits may include various surveillance tests. Avoid high-risk foods. Foods such as raw eggs, mayonnaise, raw or partially cooked meats, pâtés, unpasteurized milk and cheeses, and shellfish are high risk for infection. Physical activity and light exercise are encouraged. You will be referred to a cardiac rehabilitation program. Until your breastbone is fully healed, you should not lift objects heavier than 20 pounds. This will take approximately 3 to 4 months. Sex life. Many people who have had a transplant can return to a normal sex life. Wait for your surgical wounds to fully heal, and use the same common sense approach as you do to building up your other general physical activities. This can take a few weeks or even longer. Conception. Women and men should use an effective contraceptive method, as some of the medications can cause birth defects. Women who wish to become pregnant should notify the team so that you can be properly counseled by a specialist in high-risk pregnancy prior to conceiving. Pets. Keep your pets healthy. Always wash your hands after contact with them. We strongly advise against changing cat litter trays. Other activities. Other common daily activities are also important. Talk to your healthcare provider before you resume driving or when you want to go back to work post-transplant, as circumstances are different for each patient. Travel. We advise against out-of-country travel for 1 year after your transplant. Please speak with your transplant team about your travel plans in advance. All of these things can feel overwhelming. This is normal. Your team will be there to help you adjust to your life after transplant. What is the long-term outlook after a heart transplant? The medications used after transplant come with significant potential side effects. Complications may occur and can include organ rejection, infections, cancer, kidney failure, coronary vasculopathy, narrowing of the vessels which supply the heart, diabetes. In general, 10 out of 100 heart transplant recipients die within the first year, most around the time of surgery, if there were complications. If you survive the first year, your life expectancy following surgery is 14 years on average. Our longest patient survival is over 30 years following surgery. You may still have questions about heart transplant. Your healthcare team is here to answer them and provide you with other resources you need to support you through your transplant journey.